What if your chronic pain did not start in your muscles or joints, but in your gut? Today on WellWaveNOW, we are joined again by Ani Papazyan to reveal how digestive health can drive muscle tension, limit movement, and even trigger long-term pain. Welcome to WellWaveNOW, your portal for actionable wellness insights. We, Breck Rice, Dr. Bob Levine, and myself, Tim Daniels, are your wellness catalysts committed to elevating your health, enhancing your functionality, and optimizing your performance at every life stage. WellWaveNOW, where timeless wisdom lights your wellness path. Ani Papazyan is a pain resolution specialist, functional nutritionist, and the creator of the Precision Pain Resolution Method. She brings a powerful blend of musculoskeletal expertise and gut-focused functional nutrition to today's discussion.
Hey, Ani, it's so exciting to have you back. We loved the discussion we had with you before and excited to hear more about your expertise, especially in this area. And so thank you for joining us again. And how have you been?
Hello, gentlemen. Thanks for having me back. I am excited to be here. I'm honored. Thank you. I've been fantastic.
Great, great. I know you are on a break from touring right now, which is amazing. And for our listeners, Ani has the opportunity and privilege of traveling with superstars that perform all over the world. But you have a residency now in Vegas with
Janet Jackson.
Janet Jackson. Yeah, so what a fun opportunity for you and for us to learn from you today. But we want to jump into this because most people think about pain as being musculoskeletal, right? It's got to be something with my frame or with my muscle. But you are going to teach us something different, that it could be actually related and connected somewhere else and possibly the gut. So can you explain that muscle organ connection and help us better understand that function?
Well, I love working with this, and I'm so excited that when team brought it up that we can address this at this episode, because there is such a neurological connection between your muscles and your internal organs that most of our, conventional medical system does not pay attention to or aware of it. And I was just fortunate enough to study with some amazing doctors who studied from someone else. And this is muscle organ, internal organ, and muscle connections, which is, they are neurologically connected. So if you have any digestive issues, it can show up pain in different parts of your body, which is very exciting. And it's fun when I show the client and then we treat it and then they see the results. It's like this amazing aha moments.
Mm-hmm. So what are some of those common, I had to catch myself, Ani, because you sit there and say it's fun. I had to let you complete that one.
It is. Okay, so I have to say, in the late 1800s and early 1900s, some Russian doctors and German doctors, like I have here, Dr. Glacier and Delico zones. Mm-hmm. What they noticed that some of their patients that they were complaining about, let's say neck pain, back pain, lower body pain, they made this connection that all of these patients had specific internal organ dysfunctions. So they created these zones. Like there is, like I said, I have this chart. These are my cheat sheets sometimes. Yeah. That there is a Glacier Delico zones. And if you look at this, it says intestinal disorders. And then on here, it says it shows up in the skin, in the skeletal tissue, or the connective tissue. And it goes on with if there is any cardiac disorders, where it shows up. There is also Dr. Head, I think he was like the early 1930s, that he also created the head zones. And it's just, I think his last name was Head. Okay. And he created the head zones where you will see, like you have the pain, the color coded. So you can see, like here, the pain, blue. Yes. And I look in my cheat sheet and it's lungs. Or in the 1970s, I don't know if you ever heard of Dr. Paul Yannick, who I know we're going to get into down the in a little bit, hopefully, since we're talking about gut connection, we're going to get into some microbiome. Dr. Paul Yannick used to publish papers in the 70s about microbiome. They used to call him the quack doctor. Well, this is from one of his kind of when I went, I was studying with him. And the same thing, he has here a chart of, let's say, if it's a large intestine issues, which I see all the time, you may feel pain in your hamstrings or in your TFL, tensor fascial lateral muscle, which is on the side of your hip. So it's not just like one person, there are charts that exist that some practitioners do learn how to recognize and address these issues and really help people overcome this pain that they've been dealing with for a long time. My long answers to your question.
So would that explain, Ani, why when I do visceral manipulation, people experience pain all over the different parts of the body? It refers pain out from the visceral compartment, the stomach compartment, basically going to different parts of the body. Would these charts explain why I noticed that a lot?
It could, yes. Definitely, yes.
So
Like
why
I
do you
said, go ahead.
Oh, no, go finish your thought.
Oh, no, please.
No, because I'm so curious about this, and why is it so often overlooked, right, by your traditional healthcare provider not making that connection?
Well, unfortunately, our traditional system is set up to work with, it's a symptom base and not the symptom, system space. They go after the symptoms. Okay, the patient comes, they have these symptoms. Those symptoms equal to this diagnosis, which equals to this medication most of the time.
Mm-hmm.
But when you're working with the practitioners that look at the body as a whole, we don't isolate, oh, your neck hurts, well, let me just pay attention to your neck. Practitioners like me, we look at the body as a whole. Yes, your neck hurts, but is that the root cause of your pain, or that's just a symptom of somewhere else, sending pain? Would it be energetically? Would it be, neurologically, it's sending pain somewhere else? That's another reason why I look at dermatomes. I have a huge chart of dermatomes in my office where the client says, oh, I'm feeling this referral pain, let's say, down my leg. And last time, I think in our last episode, we addressed that, how I had a patient who came to me with, he called it, he was diagnosed sciatica pain. But after speaking with him for a while and having him show me the pain pattern, it turned out to be femoral nerve issue instead of sciatica issue. So also knowing the dermatomes, where the nerves come out from your spinal cord and what the pathways they go to, it's like I have that cheat sheet in my office, like a huge chart.
Yeah. So I think you just explained what a dermatome or a dermatome is, but clarify that for me. Breck likes to throw those big words around at me too, and he knows I don't understand them. You must have been talking to Breck and said throw those big terms at Tim.
Oh, it's so funny. No, dermatomes are where the nerves come out of from the spinal cord. So we have our cervical spine, thoracic, what is it?
Lumbar,
and then coccyx. Mm-hmm. So from each section, there are nerve comes out of from both sides, mm-hmm. and they have a specific pathway that they go to. And so when you look exactly like in a chart, and I'm trying to see if any of my things that I have here, it has the dermatome chart, but I don't think it, oh, yes, it does, right here.
Well, while you're doing that, maybe before you do that, you also mentioned sciatic and
femoral.
And femoral. Can you explain the difference so our listeners can really understand what you're talking about?
Well, the sciatic nerve, it comes out of usually between vertebrae, like a lumbar vertebrae, L4, L5, right? Mm-hmm. Well, femoral nerve comes out of from L2, L4, and their pain pathways are very different. So if you look up sciatica nerve pain pathway, is sciatica nerve goes from your lower back, middle of your buttock, goes down to your back of your knee, and then from there splits into two branches, which one of them continues all the way down through your calf, all the way down to your ankle. The other one goes from the outside of lower leg all the way down to your ankle. That's the sciatica nerve pathway. The femoral nerve pathway is very different. It starts from your L2, L4. It goes down. Sometimes you would feel pain on the front of your thigh, inside your thigh, depending if it's lumbar 2, lumbar 3, I think it's 4. And then it will go inside, inner part of the knee, lower like calf, and inside of your foot. So when I'm looking at the dermatome chart, it tells me, okay, this nerve, let's say from lumbar, how far down it goes, because it's color coded and I can easily follow. So when the patient says, my pain refers all the way down to my leg, I'm like, show me exactly where do you feel it? Because then I'm going to look at my dermatome chart and know exactly where that nerve is coming out of, and hopefully know the nerve.
Okay. Now on this, now, I want to step back up into the, the gut pain portion. Now, but just for clarification, when we talk about in our context here, when we say gut, are we referring to the stomach? Are we referring to the intestines, or what are we?
All of it.
Both of them.
All of it. Yeah.
Okay.
I'm not going to go to say, okay, stomach, duodenum, jejunum, ileum, going to break down into chunks, but it's your gut. It's your stomach, small intestine, large intestine. It's your whole gut function, because
it's all the soft tissue too. Everything. It's all.
Exactly. All the membranes, everything, the
Yeah.
fascia, they all have to work. And if one part doesn't work properly, or sometimes I have clients, if their ileocecal valve is open, which connects the large part of last part of your duodenum, ileum, jejunum to starts into your large intestine, then your digestion is going to mess up, your elimination is going to get messed up.
Okay. So just a curiosity here. So have you seen any other system that affects so much in the body? Like, for example, if your kidneys have problems, you're going to have neck pain from your kidneys, or?
Yes. So I'm so glad you asked, because I have my cheat sheet here. So the kidneys, yes, the upper trapezius on the left side, and psoas on the left side.
Okay.
So those are affected by your kidney.
All right. All right. So we might have to have you come back and talk about other body systems and parts at some point too, but we'll.
Next time we can do brain and neurotransmitters.
Yeah, we want to get into Bob's brain. We really want to understand what's happening.
We've been trying to understand that for years now, but that would be a really good topic.
All right. But now, so going back to this gut brain thing, you mentioned the microbiome a little bit. So let's talk more about that internal environment of the gut. And I thank you for, clarifying what we're saying, what all encompasses in the gut when we talk about here. But let's talk specifically about the microbiome and inflammation. How do the microbiome imbalances contribute to these chronic pain patterns that you've talked about here, Ani?
Well, when your microbiome is not working properly, and just to say what microbiome is, it's the good bacteria. I think, if I'm not mistaken, it said that humans are 90% bacterial cells and like 10% human cells. So the bacteria, the colonies, the good bacteria has to outweigh the bad bacteria. But it's when there's in a proper working, when you have a healthy microbiome. And these days, if you don't have a healthy microbiome, have you heard of microbiome transplants?
Yes.
Okay. So sometimes people do, and I used to have my a friend who was a microbiome donor because he had such a healthy microbiome. But we're not going to go into what that entails too. So, but so when you don't have a healthy microbiome, gut bacteria, it can contribute to systemic inflammation, which in turn can contribute to more body pain, chronic pain, inflammation like arthritis. There is also, what's the word? Your pain sensitivity can be enhanced as well.
And that inflammation is then what, a trigger to amplify the pain?
Yeah, because it increases Dr. Bob, help me with the pain cytokines. Thank you. That's the word I was looking for.
You're gonna lose me on that.
It increases the pain cytokines.
Yeah, you lost me on that one because I don't focus on that. So
okay.
I left that behind a while ago. Sorry, I can look it up for you if you want.
No, it's okay. No, that's the word I was looking for, the cytokines.
Okay.
Yeah, that's what, when you don't have a healthy microbiome, that's what happens. That's how it addresses, can enhance your body will feel more pain.
Yeah. I always remember that term also when it goes back to the COVID world, where they said that would also lead to some cytokine storms in the body.
That's a different cytokine storm. Yes, the what they call the spike protein, storm. Yeah, a spike protein cytokine storm.
I know they're always concerned about, medications affecting that microbiome right in your gut and killing off the good bacteria if you're on a a really strong, like a Rocephin or something like that antibiotic. And so you have to replace those. And so that's why there are products for the, pre and probiotics to try to replace that, or just yogurt cultures and different things that can make those healthy biome cultures kind of thrive, because you killed them all off if you're on a really strong antibiotic, right?
Exactly. That's why you take a really good probiotics. There are prebiotics. There are fermented foods, like kimchi, sauerkraut, those types of foods. You mentioned yogurt. Hopefully it's a good quality, not with a bunch of fruit in there that sugar outweighs everything.
Yep.
But
So,
yes.
So when you first start working with people or encounter them, how do you identify whether or not they've got a good gut microbiome, or do you assume that they're always off and that requires some work on?
Oh, that I wouldn't know unless they complain about digestive issues, or sometimes, let's say I'm seeing a client, they come to see me for a pain and I work on it. And then when I see them next time, whatever I released, it didn't held up. They're back to the same pain. Then I would ask, do you have any digestive issues? Unless they already a lot of times people don't make the connection. Like when they fill out my intake form, it's not a 20-page doctor's intake form. So unless they put in there that, yes, I have digestive issues or I'm taking medications for this. But so the second time when I see them and the pain is exact the same, the release didn't held up, I would ask, do you have any digestive issues? When they say yes, then I would go and I would check their abdominal area. There's specific acupressure points that I know it's a stomach point or it's a large intestine point, and I will test, like palpating, to see there's how sensitive it is, how hard it is, because I should be able, like when I'm touching between their xiphoid process end of
the rib cage.
The rib cage, yeah. When the sternum ends and between the belly button midway point, that's a stomach point, acupressure point. I should be able to put a pressure there, about 60-pound pressure there, and you should be fine.
60? Did you say
60?
Yeah, 60
Wow,
pounds.
that's a
Wow.
lot.
Yeah, and you should
Whoa.
feel fine. Like when I do in the mornings, I give myself abdominal massage and I press. It's gotta be soft. It shouldn't be any pain.
This
When
is
there
really
is-
important. What you're talking about is really important. So you do that on yourself in the morning. I do the same thing. I do it before I go to bed at night. It's so important. People would just do that for less than 5 minutes.
Less than 5 minutes, literally minute or two. I do abdominal massage in the morning.
So can you say something just in general about how you do that, just so that people can get an idea?
Oh yeah, it's very simple. So think of it, usually your large intestine starts your lower right, goes up right under like your rib cage, straight, and then down on the left side. So you want to go clockwise, lower right, up, down to the left side. And you're just doing circular movements. It's nothing fancy. It's just a gentle circular movements. Now, if you're constipated, you don't want to start from lower right, push down to the left, because there's no place to go. Then you want to gently push down from lower left, and you're slowly working yourself up. Like you're going backwards, but you're pushing down the left, because you want to open up space before you push from the right down, because there is no place to go.
Okay. So now you and Dr. Bob both said this was very, very important. Why is it so important?
Oh, it stimulates your peristalsis. That's the right word, right?
Which is the movement of food through the intestines.
Exactly. It stimulates the movement. It also stimulates for you to movement of your large intestine, like going number 2.
Which people do.
Well, hopefully they do. Trust me, I have some clients that they don't. Like going once or twice a week, that's their norm.
Yeah. So
when they do this, they have a better chance of going more regularly. And I have something to say about that later. Tim, go ahead.
Okay. So now we went down this path of the gut massage and why that's good, but you also then talked about now they answered the question about they've come back with there's some digestive issues, but then you've identified the pain associated with that. But now, can you give us some examples when you have identified that is gut pain, that is digestive issues, and you've addressed that, where that's been beneficial to the client? What type of results what type of changes have you seen after addressing that?
Well, the first of all, it's a dietary changes. Usually I have the client, depending how receptive the client is to making changes or how big of a change they're willing to make. For some, it's just a simple dietary changes. Okay, get off inflammatory foods like the basic, the gluten, the dairy, at least for a while. Or pay attention how your body feels after you eat pasta. Do you feel bloated? Do you feel gassy? That tells me, okay, gluten, their body cannot handle gluten. So for some, it's just simple changes, dietary changes, or incorporate some prebiotics or probiotics or digestive enzymes. You take a 1 or 2 capsules of digestive enzyme before a meal or hydrochloric acid after a meal. For people that's like, Ani, tell me whatever I need to do, I'm going to do. I would say, you know what? Let's get you on a very gentle 30-day cleanse, which is only like maybe 3 or 4 specific supplements, which, the releases toxins, accumulated toxins. One of the products does that. The other one, it's a binders that will bind those toxins. And the third one is a probiotic, which
So in those
colonizes
cases,
the
have
gut.
you seen the neck pain disappear?
Oh, absolutely.
So
Absolutely.
yes. All right. Give us some other examples of, where you said the connection is. What have you seen disappear by, or disappear is not a bad term. Let's say been addressed and been resolved by doing.
So there was a gentleman, he came to me with a knee pain.
Mm-hmm.
And I was looking at the knee, I'm like, nothing feels tight. I'm just touching the muscles, the thigh, lower leg, anything that will, like hamstrings, that would affect the knee. And then all of a sudden, I'm like, do you have digestive issues? He goes, oh my God, that's a whole other thing. So I started doing some visceral massage.
Mm-hmm.
And then I had him take digestive enzymes before a meal. And then literally about 3-4 weeks later, huge difference. His knee pain almost completely disappeared.
Hmm.
Yeah.
So what percentage of apparently musculoskeletal pain, like neck pain or shoulder pain or knee pain or back pain, what percentage of these apparent, I'm going to call them apparent neuromuscular pain conditions, would you say are related primarily to gut disturbances versus neuromuscular?
Oh, that's a tough one. The only thing I could say based on my practice, like my clients' examples, I would probably say maybe 20%.
Okay,
Yeah.
that's what I'm thinking. Yeah, I wasn't thinking it would be a lot higher than that, or but 20% is significant.
Significant.
Yeah, for
It
sure.
is. Yeah, I think so. I think so.
Especially when so I learned about visceral manipulation from a guy who was a neuromuscular therapist, a deep tissue person, and what he noticed was he could unlock neuromuscular problems, and then a week later they were back, and he kept coming back with the same thing, and then he stumbled across his version of visceral manipulation and was resolving all kinds of things. So for those patients where that happens, it's really important. I do it now with just about all of my patients, clients when I see them. If I take 5 minutes in the beginning, I do a little bit of that because I look for hot spots, like where when I push in, is there discomfort, because that's really important to resolve that. And people don't feel them right until you push on them.
Oh, exactly. And it's about fascia. Doesn't matter. The fascia from head to toe is connected.
Okay. So you get now, Ani, that's I don't think everybody's heard about fascia. So you got to articulate what that is. I actually just came across it myself here a couple of years back, and I don't remember what in context. But I think please explain that, because I think people started talking about it as a 2 years back. So it was like a people were seen as a new system in the body, even though it had been existed.
I know that cracks me up because we've been talking about that for, I don't know, for so long. I remember even when I was in college, and I so remember in one of my textbooks, it's so clear, like I can visualize it. It was like a sweater, and the example of it was a knitted sweater. So if you pull from the one parts of your sweater, you pull the thread, eventually the whole sweater goes out of shape, and that's fascia.
Okay.
It's connected. If you look up, like Google the fascia in anatomy, you can see from the tip of your toe all the way to your head, the fascia is connected. You have the fascia membranes between your organs. Everything is connected.
Right.
And
Yeah,
the
so I
technique.
want to remind our audience, I guess, that, Ani has a heritage or training that includes some of the Eastern Europe, some of the European philosophy where they've went into this. But like I said, in the West, I'm gonna time flies for me now because I've been associated with Breck and Dr. Bob for the past few years. So I can't tell if it was yesterday or 3 years ago, but sometime in that time span is when it first started appearing in a lot of the Western literature, like it was some new organ that really needed to be focused on. So I'm glad you're bringing some of that wisdom over to us here, Bonnie.
And also there's a technique called myofascial release,
Yes.
which practitioners have been using for many years. And so outside of conventional care. And
Exactly. Who
yeah.
was the famous gentleman, older, really like rugged looking gentleman, Upliger Institute that teaches myofascial release.
Yeah. And it's really a gentle technique, and it's very, very simple, very gentle.
Yeah.
So Ani, let's continue on with what we were talking about, identifying some of those pain triggers that might be related to gut, right? Because we mentioned, or we discovered through, we'll have to actually do some research on this, but maybe possibly 20% of the pain might be coming from someplace else than the actual musculoskeletal or even nerve pain, right? It could be something related to your gut. So how would somebody tune into their own body and identify that better? Where is that pain coming from? How would somebody be a detective and figure that out for themselves?
Well, it's and I like when you said tune into their body, and that's exactly what you need to do is tune into your body and be aware of the signs and symptoms. Like earlier I mentioned, when you eat food after a meal, do you get really tired? Do you feel bloated? Do you feel gassy? Do you feel like you need to take a nap? Those are all signs of your gut is not functioning the way it should be, because usually you should feel the same way before a meal as you do after a meal without being hungry.
Mm-hmm.
So if you're getting those symptoms, those are signs of, okay, maybe my gut is not functioning properly. Or you go to a practitioner, they work on it. You go to like a massage therapist or physical therapist, they work on it. It feels better, but and then your same pain keeps coming back. Those are some of the signs of, okay, we're not addressing the root cause of it.
And we need to pay attention to those patterns, right? Like
Exactly.
you mentioned specifically like pasta, for instance. If every time you eat pasta, you feel bloated or whatever, you need to pay attention to those patterns that are happening.
Yes, or like some clients would say, oh, I can't eat broccoli or raw salad because I get gassy after it. Or they can eat beans unless you're, from the parts of the world where bean growing up was a staple in your household, because beans have 5 sugar chains, and it's hard for a body that's not used to break it down. So you are going to end up with gas.
But Ani, you gotta talk. There are some, I always grew up, and so it's always good being with you because you can correct old bad patterns. But I always grew up the same way. Hey, broccoli is supposed to cause gas, or cabbage is supposed to cause gas, and beans are supposed to cause gas. Now you're telling me they shouldn't. So what's
No, they're not supposed to. Just because it doesn't mean it's like, I love that you said that, because sometimes I have a client who comes and says, oh yeah, my doctor said that pain is normal for my age. No, it's the same thing. It's like, oh yeah, when you eat bean, it's normal to be gassy. No, it's just like I said, it's a 5-chain sugar chains that beans have. And if your body is not used to breaking them down, then yes, it will cause gas. It doesn't make it normal.
So Tim, should you
Bob
just eat more? You're
Yeah, I was
supposed
about to
to
say,
eat
so
more of
Bob,
it?
yeah.
Say what?
So Bob's gassy with the bean. And Breck was saying, should he just keep eating more of them until he gets over it? His body learns how to process
There
it.
you go. Yes.
Boy, your
That's
poor
when
family.
the microbiome kicks in. That's where you gotta start taking good digestive enzymes and colonize your gut bacteria until it becomes healthy.
Do you ever run into patients where you figure out that their rate of eating is really fast, or fast eaters, so they're not chewing their food, and and it's messing with their digestive system? Is there any?
That's one of the things, like, I would ask, how fast do you eat? I'm a fast eater, unfortunately. And that's something I personally also work on. But, I just ask questions. Thankfully, I don't have any digestive issues. But, it's about asking the right questions,
Yeah.
and as simple as they may be, it's the questions you ask, and or tell the clients, pay attention to this. Or sometimes I ask the client, do you always chew on one side? They're like, you know what? I don't know. I never paid attention to. I'm like, well, next time you eat, pay attention. Do you chew on one side only?
Yeah.
Interesting. What's occurring to me, I love talking to you, Ani, because my mind starts working in new ways. And one of the things that is occurring to me is that I always talk about multimodal treatment, combining modalities together to get the best result. Now, what I'm thinking about is these chronic pain conditions, there's multimodal inputs to the pain. There could be a neuromuscular component, a fascial component, a digestive component, and you got to get at all those. And, maybe that's why people struggle with, some practitioners really struggle with helping people get out of pain.
Yeah.
Yes, like I said earlier, we have to look the body as a whole from every systems.
Yeah,
So
for sure.
that's what makes it fun.
You know, back on our bean comment, I'll
Uh-oh.
I'll tell you something personal here. I used to avoid, even getting a, taco salad or burrito or whatever, and they'd say, black or pinto beans. I'd say, no, just more rice. I'd kind of avoid the beans and just get, a little more rice. But, when I decided, hey, I need to start cutting back more on the meat protein and focus more on vegetable and nuts and getting more protein that way. I wanted to add in beans, and I can tell you the big differentiator for me was the probiotic or a prebiotics. Those completely changed the entire game, and now, man, I'll put extra beans on that, because I know I'm getting the not only the good protein, but I'm also getting good fiber from that, and that pro and post and prebiotics that made the complete difference for me.
So as we work to, part of what we're doing here is how do you help people and identify things? And what you've gone through so far, if I understand correctly, it's been observational. There's some manipulation, like when you get somebody's pressing on their stomach and maybe they can notice tenderness. If you're massaging them, you can notice if it causes any pain. But then you've really kind of said, track yourself. You're having issues. Are you having issues? Are you eating on one side? I guess where I'm headed with this, are there any other tools that people should use aside from that can be used? Are there any testing that can be done? Or is it really observational to really start self-identifying, self-diagnosing a little bit here?
Oh, no. With patients like that, I usually ask them if they have any lab works, blood tests done, to send me, if they feel comfortable, to send me their lab works, because I want to see their comprehensive blood panel and to see what jumps out. Because sometimes I was trained to look at the blood work functionally.
Yep. And so what type of, those panels, I always have to, when I get mine, I go and I Google everything, and there's some like 90 things to Google in there. So in particular to this particular area on the gut, the gut portion, what are you looking for, Ani?
We're looking at the, CBC, CM, like comprehensive wellness panel, comprehensive metabolic panel. I'm looking at your like white blood cells, their differentials. I'm looking at your magnesium, potassium, carbon dioxide. What is it? ASL, ESL.
Yeah.
Don't ask me to tell the abbreviations because I don't know.
I just remember them being on mine. That's why I said, yep, I remember those.
The total protein, albumin, globulin, and then I'm looking at your red blood cells. The red blood cells comes with MPV. Now you put me on a spot. Mm-hmm. So I'm looking at all those biomarkers, and all those tell a story. Some of them that tells me you have blood sugar issues. But the client says, yeah, but my blood sugar is normal. Yeah, but when I'm looking at let's say your total protein or globulin, or total protein, that could tell me that you do have blood sugar issues. And then I tell them, do you have these symptoms? Like when I mentioned, after a meal, do you crave sugar? Or if you don't eat for long periods of time, do you get really moody, pissed off, get shakes? They're like, oh yeah. I'm like, well, that's blood sugar issues. And these biomarkers tell me that.
Hangry. People get hangry.
Exactly. So that's why, like, I would ask the client, if you have any latest from the last 6 months, send me your blood works, let me take a look at, because that also would tell me why they're having certain symptoms.
Okay.
Are there any other
Brett,
assessments, or is it mainly just the blood markers? Are there other assessments?
Well, depending on a client, if I need to, if I think, especially if they're going through perimenopause, menopause, I may ask for their hormone panel, and I like to do saliva hormone panel because it's not a protein bound. When you do blood work, blood hormones, most of those are protein bound hormones. When we do saliva, it's a free fraction hormones. Or if the client is open to it, I would suggest them get the Dutch test, DUTCH. It's a dry urine test, which gives you a larger picture of the hormones because it includes all the metabolites and everything.
Yep.
So it's just depending. Or if a client, again, has blood sugar issues, I would love to do adrenal stress index, which is a saliva test where they collect saliva 4 times a day. Then we'll see the curve. Okay, in the morning, your glucose is supposed to be higher. As the day progresses, it gradually needs to go down. So the evening, the melatonin goes up, because evening, if your blood glucose is really high, then melatonin cannot be there.
Yeah.
So looking at those types of things.
So Ani, I have a question. For our listeners, a lot of more than 1 in 4 people in America are in chronic pain. So and most of them are going to see practitioners of all kinds, physical therapists, chiropractors, acupuncture, massage, whatever it is. And so if 1 in 5 or even 1 in 4 have gut related pain problems, those are some of the people who are going to go to practitioners. And even for the most exquisite practitioner, that practitioner may not be able to get them out of pain unless they know about gut involvement. So if somebody fits in that category, and I imagine if we had 100 people on the call, that would involve about 25 people or so, 20 to 25 people, according to what we talked about. Where would you send them? How do they know where to go? It's like, wow, I'm still in pain. I get seen every week. I feel good for a few days or, whatever. And then I'm seeing the same practitioner for the same problem. Where do you send them?
Well, it's a tough one. Usually I would say, if you cannot find me, then you'll find a functional practitioner. There are a lot of chiropractors, nutritionists, dietitians that become functional medicine practitioners, where we look at the body as a whole. I mean, not all of them will be able to do a massage or visceral massage, but they'll be able to give you better answers than your conventional doctor would.
Okay, thanks.
Now, on that visceral massage, is that something that a 20% of massage therapists want to know, 80%, 0%?
Unfortunately,
how about less than 1%, I would say.
Yeah, unfortunately, in United States, and this is from when my time, and that was a long time ago, I finished my massage school in 1995. We had amazing practitioners, actually doctors were teaching us, and they taught visceral massage, abdominal massage. And then later, when I would take some advanced seminars, or even I was asked by a few massage therapists, because for them to get the certification, they need to work on someone. And they would ask me, could you come be my dummy so I can work on you? And my question would be they would do the full body massage. I'm like, what about abdominals? They're like, oh no, we don't learn abdominal massage.
Yeah. Good.
How can you not?
It is pretty crazy because every massage therapist I've talked to, nobody, and patients, clients, has anybody ever done anything like this for you? No.
Yeah, no,
That's the first thing I do. I'm telling you, it's the first thing I do. If it's not an online thing, if I have an online client, I'm demonstrating, and I'll back away from the camera, demonstrate how to do it. And then I'll give them written instructions and a video, and, so they can do it themselves. I mean, it's so important. It's just amazing.
Agree.
Yeah.
Absolutely. They say, your gut is your second brain, right?
Yeah.
You actually have more neurotransmitters in your gut than you have in your brain.
Yeah. I'd heard about that. I didn't really come home to me until I was having some gut challenges here last year. And we all use the PEMF, and I was doing PEMF on my head, and then I could feel it in my stomach. And where I hadn't before, when everything was in balance, I didn't, but I could really feel things stir up when I applied the PEMF in my head. I said, well, there's something really going on here, and that's when I drove it home. But now,
PEM, pulse electromagnetic field therapy, right?
therapy,
I just want to say that because we didn't say it yet.
Yeah,
yeah,
I love
appreciate that.
PMF.
Aside from the visceral massage, which you can teach remotely to folks, now let's just assume, well, we are going to take 20%. We said 20% of people we're guesstimating.
That's just in my practice. That's what I've observed.
And it could be higher, actually. It could be higher.
Yeah, it wuld be higher. But so for those who won't see us, I was doing my little air quotes to say, guesstimating. But let's just say people want to say, look, I'm having some pain and I want to make sure my gut's functioning well. And then they don't, they don't want to go out and take the diagnostic test or anything. Where I'm heading with this is practical universal steps to work on my gut microbiome and its environment. What should people be doing in general?
The first thing I would say, the simplest thing and the money-saving thing, so you don't want to go through a bunch of tests, is do the 30-day gentle cleanse. It's only 3 products, the basic version. It's simple. It's not huge dietary changes. I just, like 2 weeks ago, I did my 30-day cleanse. It's very gentle. And it's just
what do you do for as a cleanse? That cleanse is a term that's out.
Oh no, I'm not talking about you're eating food, normal food, regular food. You're just taking 3 supplements. And I mentioned earlier, one of them, it helps release toxins. The second product, it has the binders in it that binds to the toxins and pulls it out of your body. And third one is a probiotic that colonizes your microbiome. That's it.
What type of toxins are you removing? Are you doing a heavy?
All kinds in your body. It's not specific like heavy metals or anything. That's why, like most people, generally you're supposed to be doing some kind of a cleanse at the beginning of every season. Like we have 4 seasons. Usually I suggest clients to do in the spring and the fall, but you should be doing some kind of a cleanse at those times because the times change. It's a new beginning. Energetically, it's also really good to do these cleanses.
Now, Ani, I know what Dr. Bob was going to ask, and for our listening audience, is that something that you want people to reach out to you about, or can you tell what those 3 supplements are, like, glucuronolactone for cleansing or whatever it might be?
Oh, I like the Biocidin company. Like if they go on my website and where it goes products we love, I have there, it says cleanse. They click on it and it takes them to a page site where they can actually download the full guide, step-by-step guide that takes them through, and it explains what the products are. So Biocidin is the company that I love because they're very clean products and they don't have thousands of products.
Okay. So your cleanse is clean eating
combined with few products.
Combined with few products. At some point, we may have to find what clean eating is. Bob considers pepperoni pizza clean eating.
No. I love pepperoni pizza, but I don't eat it. Once in a while, I'll have a little
pizza is fine. My friend, they have a wood oven outside of their house.
Wow.
Oh, when she fires it up, she goes to the Italian market and buys all the dough and all the fixings. And we all open up our own pizza and do whatever. We build it. Yeah. And that pizza is heavenly.
Yeah.
I'm just not a dairy guy much, so I try and stay.
We'll give you the cauliflower dough pizza.
There you go.
Yeah, that's right. Yeah.
So people have gone through the cleanse, they've established that environment. Then what else then after the cleanse, and you recommend twice a year, what comes next for this?
Well, if someone's doing that, like I said, there are so many, like how deep do you want to go? So if you're going to do a cleanse, I'm going to ask you to do a lymphatic drainage because that's going to enhance that detoxification process. Mm-hmm. So lymphatic drainage would be if you have a mini trampoline, you jump on your mini trampoline. You have a vibration plate, you do vibration plate. You don't have all that, you get the natural bristle brush. you do brushing, lymphatic drainage, which I have on my website in a resources page. I have
What's
a
your
free
website?
PDF download.
What's
It's
your
a
website?
laststopforpain.com.
Laststopforpain.com.
Yes.
Cool.
And
Nice
yeah, I
name.
can't believe it's usually will show up. It's laststopforpain.com. In a free resources page, I have right on top, it says dry brushing. It's a step-by-step PDF that they can download and follow. So lymphatic drainage. And then like I have at home, I have it looks like a sleeping bag, but it's an infrared sauna. Get into a sauna, sweat it out.
Yeah.
That's one of the best ways to get rid of the toxins and warm up your muscles, relax your joints, your muscles. It just, again, depends how deep do you want to go.
What I love about what you're saying though is that everything you're saying is not high ticket, you can usually find a sauna somewhere at a health facility. You talked about the mini trampoline. That's brilliant, jumping on the tramp for lymphatic drainage. I've never actually heard that before, and yet it makes total sense.
Oh yeah, I have my mini trampoline right there. I have my vibration plate is right here.
Yeah.
Or I have it's actually in a bathroom. It's a dry brush, like a small little with a natural breezes wooden brush that you just sit there, or even forget that. Just do tapping about 30 seconds here, and then you go, tapping where the most lymphatic things, lymph nodes on your groins, on your neck, or
Yeah.
just gently. That's it.
Yeah. Beautiful.
Yeah. Now, would you also suggest, besides all of these techniques, also movement of some kind?
That was going to be my other thing, simple like walking. You don't want to, if you have a lot of like systemic inflammation, you don't want to force yourself to do hardcore exercises because exercise itself puts stress on your body. So, gentle movement, walking, grounding, earthing, grounding is so essential. And that, Dr. Bob, your background reminded me of that. Walking
right.
barefoot on a grass, dirt, earth, or if you're like my friend living in Edmonton, Canada, where it just snowed again, you go and you put your hand on a tree because that's connected. It's again, electromagnetically, it's an electromagnetic field. So you just touch a tree to ground or earth yourself. Or I have right under my feet. This is one of the connection. I have my earthing mat that's connected. My bare feet are on it. It's grounding me as I'm sitting in front of the computer. There are so many things you can do, as expensive as you want to do or as cheap as you want to do.
Yeah, that's
And
great.
all these things are going to affect your gut.
It can contribute to the healing of it, yes.
It's a fascinating subject, and it just shows, I think it can show everybody how little in total we know about the human condition. I mean,
another simple thing is, and I remember because I can still see the poke. For the first time ever, I donated blood because I'm terrified of needles, but it was for Children's Hospital. And I have O negative, which is universal donor. It's a great blood type. So I donated, but as my friend was asking, it's not just good to donate. It's also good for you, not only for your body that makes new blood cells, but I did a research and it's amazing. It helps with heart health. I had no idea that donating blood can help with your heart health. It slows down or lowers your cancer risks.
Wow.
Yeah, there's like so many health benefits for you to donate blood.
Interesting. Man, it's fascinating, really. Gosh.
Yeah.
So how long does it typically take for somebody to start feeling the difference? If they were to follow your methodology, is it something that happens immediately or is it several sessions?
It's a few sessions. Usually it takes 4 to 6 weeks, depending again, where you are, how compliant are you doing it at home? Are you doing your homeworks, everything that I'm suggesting? But usually they would start feeling with the gut about 4 to 6 weeks, definitely.
Okay.
So you talked about how you have spent time on the road with different people. If people want you to come, would you go see somebody at their where they live? They pay your expenses. Would you do that for a week or so?
Oh, if you want to fly me out, especially south of France, Please.
Oh,
I'm a very light packer. My passport is up to
Hmm.
date. Oh, I can pack within 5 minutes and I'll be on the road.
but
Yes.
are you available? Seriously, are you available for something like
Absolutely.
that?
Oh,
Okay. All right.
absolutely. Yes.
Does it have to be the south of France, or would it be in the
It
United
could be Tuscany. It could be
Well,
United States too.
Oh, it could be
I
United
thought you
States.
might want to go to. I thought you might want to go to Biloxi, Mississippi, honey.
Yeah.
Hey, you know what? If you're gonna fly me to Biloxi, Mississippi, I'll go. Maybe I'll go to don't they have a Amish country? Maybe I'll go get some raw
I
meals
don't
or
know if they
stuff
got it
like
in Biloxi. They
that.
got Amish in Iowa and Ohio and Pennsylvania. I'm not sure
Pennsylvania.
Oh,
about-
Pennsylvania. That's what I was thinking.
Right.
But no, I'm
But-
absolutely open to if
Okay.
anyone.
I just want our listeners to know that you're available for that.
Right. So you've got a certain clientele that might be able to fly you, not you work with quite often, as we start out with, fly you someplace and have to come out. But you've also, as you went through, kind of set up things on your website, at least in terms of the cleanse. And what about other have you have some more self-study or guided study? that
Oh, I
help-
have several on my website at the resources page. There are several downloadable free resources that they can do, like for stress relief
Right.
and stuff, techniques. And then on my website, I every Friday I publish a new video where a lot of times these are self-help techniques that I share with people.
Right. And so you have things that will cover this whole, the detox certainly does. You have other things that will cover this whole gut world that we're talking about.
Probably, if you look, I have like over 200 videos, I think there's
Good.
some of it. Yeah.
All right.
So for the 80% of the people who come to see you that don't have gut issues, I just want to, in about a minute, how do you handle their chronic pain problems that don't relate to the gut?
Well, usually, and I think I mentioned this last time, for that, my first go-to is balance their autonomic nervous system. Because a lot of times especially where the world is nowadays, everything is fast-paced. We're constantly on a fight, flight, freeze mode, which, when you're sympathetically upregulated, everything your body just cannot heal properly. So my first thing is I downregulate their sympathetic nervous system. I teach them techniques to stimulate the vagus nerve, to stimulate the parasympathetic nervous system. Then after a couple of days, just the other day and she's a massage therapist. I worked on her, I swear, for like 15 minutes. She could not leave the office. Her eyes like rolled backwards. She was high. She was high. She's like, I'm sorry, I cannot like leave yet because I cannot drive. It's just so amazing to see.
So are there any self-help tips you can give people regarding vagus nerve stimulation?
Yes, one of
Because the vagus nerve is to calm down.
That's a good question. We want to do that, but I think that could be a whole nother topic we could bring Ani back for on that one. And I want to keep us here a little bit. In fact, on this gut.
I can sign up a W-2 form and you can just put me on a payroll.
There you go. And then, so I want to read a comment from the audience here as well that says, fascinating information today. I love the things we can do right now to help with the gut. Thanks, Dr. Ani, and all of you for sharing this with us. Blessings of health and happiness. So along those lines here, we'd like to leave people with that, sort of what they can do from empowerment on that. So a couple things. How do you encourage people to stay consistent with the changes so some of the changes, are just one-offs. They do their cleanse a couple times, but other things you're asking for lifestyle changes and other things to help with this gut. How do you help them stay consistent, Ani? What do you
first of all, thank you, Cheryl. And I just want to clarify, I am not a doctor.
Okay.
I know sometimes my clients call me, I'm like, oh, no, I'm not a doctor.
Okay.
But, it's a process. There is no quick fixes. There is no magical thing where I say, oh, you have to, you do this once and that's it. No, it's a process. I'm in it. I've been doing this for 30 years. And some of the stuff I still have to work really hard at it. It's a repetition. There used to be that the habit gets created in 21 days, which is not true. It actually takes about 66 days. Even the gentleman, I forget his name, that wrote the book that it takes 21 days. He's like, no, you didn't read it properly. It's 66 days, but it's a repetition. Mm-hmm. And one thing I want to say that, if you're doing something good for your body, and then all of a sudden you're going on vacation to let's stick with the south of France, and you want to eat that croissant and you want to drink that wine, please do and enjoy, and make sure you take me with you so we can enjoy it together. Or once in a while, you want to smoke that, Cuban cigar or whatever, live it, just do it.
I'm going to take you with me to Grand Island, Nebraska, my hometown, and you're going to have a good steak and some corn.
Yes. Oh,
Right.
definitely.
Forget
And
the
some
South.
good cold beer with it, especially
Forget the
dark beer.
Forget the South of France stuff. We're going to go to Central Nebraska.
I grew up in Russia, so I'm okay with it.
So, Ani, you may not be a doctor, but you certainly are an angel to a lot of people that you help.
Thank
And
you.
so we thank you so much for coming on and being with us again. Is there any last thing that you would want to make sure that our listeners know and what, they should know about gut pain that we haven't covered yet?
Just think of it. Pain is a message from your body. It's like your body throwing in a white towel and saying, pay attention to me. So pain is a good thing. It's a message. Listen to it.
Yes.
And be aware of your body, the messages that your body sends.
Yes.
And just, whatever you're doing, it's a process. Don't get discouraged and don't compare yourself to anyone else. Because one of my clients, he just told me, and I wanted to slap him. He said, yeah, I just stopped putting creamer in my coffee and I lost 5 pounds. And I swear, if he wasn't standing on the other side of massage table, I would just let him have it probably. Because for some of us, losing 5 pounds, it's a whole other hard work. Yeah. So only compare yourself with yourself, not with anyone else, because it's so easy to get discouraged. And just stay with it.
Yeah. And also, go ahead, Breck.
No, I'm wrapping up. So finish what you were going to say.
I just wanted to say that message is really important because it boils down to really, nurturing ourselves, loving ourselves, no matter what we look like in the mirror, no matter what's going on, just really taking care of ourselves. Yeah. So that's really important.
And looks doesn't equal health. That's the biggest thing. I see the most skinny, fat, unhealthy people.
Well, a huge thank you, Ani, for coming on and helping us understand the gut and muscle connection. And we're so excited to have you back again as we get into other topics. Maybe what Dr. Bob, maybe.
Well, everybody's into vagal stimulation now to calm.
Oh my God, there is.
It's like
it's
everywhere.
So funny. Yes.
You can't get away from it. So that we should talk about that.
We probably should. So thank you so much. And until next time, stay curious, stay empowered, and remember, wellness, it's in you.